Well, when he first started out, he was just having some nerve problems. They couldn't figure out what was going on. Once they determined that it was his spinal cord, he had to have major spine surgery. He was in inpatient rehabilitation for 1 month, and then they discharged him to outpatient physical therapy. Once he was home, it was like having a child. I mean, he wasn't able to do anything pretty much for himself. He could like sit up in the chair and sit up in the bed, but as far as taking a shower or going to the bathroom and feeding himself and that sort of thing, I had to assist him in everything. I took some leave off from work and was able to help him somewhat get back on his feet. And like I said, he was going to outpatient physical therapy at another facility, but they were telling him that he would never fully walk again and that he needed to accept the fact and probably need to get some psychiatric help so that would help him to be able to accept that he would not be able to walk again. Actually, I work in orthopedics at one of the hospitals in the medical center, and we received a letter from here, and I called the person, and I talked to him, and I really liked talking. He was very nice over the phone. He invited me to come for a tour to check out the facility, and we did. And when we walked in, one of the things that we observed that we really liked was that all of the therapists were one-on-one with the patients. At the other facility, it was like they'd spend 2 or 3 minutes with you, run to another patient, another 2 or 3 minutes, then run back, then 2 or 3 more new patients would walk in, and they just didn't have the time. And because Harold needed so much assistance, we knew that wasn't the place for him. Plus, like I said, they were being, really negative as far as his therapy and how he was going to turn out. So we really liked that, and Sean was extremely nice. He answered all our questions. Like I said, he gave us a tour. We liked them being one-on-one with all of the patients. The atmosphere was very relaxed, and we both liked it. We talked about it, and we knew when we left we wanted him to be here. He had his surgery in 2006, and he was at another facility for a year, so he started here in 2007. Started out with aquatic therapy for about a year, and actually after a few months we started to see the progress as far as him getting stronger. And I'd say after the year he was starting to walk, starting to do things on his own, really progress. And then after that they transferred him here to the equipment in here, and ever since then it's just been uphill. It's just been wonderful. He was at the other facility. He was always sad. He would go there, he would work out, and he'd come home and he'd still be in the same frame of mind. We couldn't see any progress at all. They didn't give him anything to do at home as far as therapy at the house. And it was just like we just weren't seeing anything. So we knew there had to be something better. And because I work with doctors, I was able to talk to them also. And they were kind of telling me things that they should be doing to help. So once he got here, and the one thing we really liked is, like I said, he could barely walk, he could barely do anything, and they started him out in the aquatic therapy, was that they had to take a lot of time and a lot of effort to get Harold in and out of the pool because he was much bigger than he is now. And of course, being around water and stuff, that was very dangerous and all that. But Sean and all the therapists took the time to help him and show him how to get in and out of the pool safely. They stayed there while he did his therapy. It was like just total concern, and we really, really appreciated that. It was definitely after the aquatic therapy. Because like I said, Harold was like a baby. He could barely do anything. The only thing he could do was sit in his wheelchair and pretty much just lay in bed. So when he would come here, I'd have to drive him here, or my nephew, we'd have to drive him here, help him get out of the truck, help him walk in here, or push him in here. Most of the time, what we did was push him in here in his wheelchair. We'd have to push him up to the door where the pool is, and he'd use his walker to walk to the pool. And then, like I said, all the therapists would help him, get in and out of the pool. So once he finished all of that therapy, it was just amazing. He was moving around. Of course, he still needed his devices, his walker and his cane, but he was moving around. I mean, it was just phenomenal, and with speed. But yeah, it made him much, much, much stronger. And I knew then, when I saw that, I said, he is on his way. He is definitely on his way. I know Harold, so I know he's a determined person and has a lot of will. So I knew it would come one day. I just didn't know when it would happen. And like I said, everybody else was kind of saying he would never be able to walk again and it would never happen. And I just didn't know how long it would take. But his therapy here is just made his life totally independent. He couldn't drive either. I mean, he's now able to drive. Like I said, he does all of his chores. He runs all of his errands. I mean, just the little things. He can feed himself. He can go to the bathroom on his own. He could take the shower on his own. All of that since his therapy here. Yeah, he was, and I know for men it's really hard, especially, and he used to say that. But like I said, he was like a baby. I would have to help him in the bed, out of the bed, to the bathroom, to the shower, help feed him, help brush his hair, just little things like clip his toenails, clip his fingernails, just the little bitty things that we take for granted. And sometimes his hands would hurt so bad, I'd have to wash his face for him or help him brush his teeth. He couldn't even stand at the sink to wash his face or brush his teeth. Like I said, just the little bitty things that we take for granted. And now he can do all of that. And like I said, it's made him independent again, and he's happy. He's extremely happy. He loves it here. Like, he tells people this is his second family. Yeah, I knew he had the will and the determination. It was just a matter of how long, and we had to get him to the right place. That was the thing. Because again, I go back to that other facility. I could not believe what I was hearing. That they were, the therapist actually pulled me to the side, and she said, "You're probably going to have to get him some help." And I said, "What do you mean?" And she said, "Like a psychiatrist or something," because she said his condition is so bad he will never walk. He will never walk like he did before. She said if he's even able to really walk again. So she said he's going to need psychiatric help. And I just said, okay. That's all I said. It was just okay. And I told Harold, I said, we've got to get out of here. And so that's when I didn't know where to begin looking. I'd been talking to some of the doctors and stuff, and I know there's tons of places out there. And like I said, when I got the letter from here, it was just something about the way it read. I liked it. So I called and talked to Jesse, and the rest is history. I tell them the atmosphere is wonderful. It's like a family atmosphere. It's very professional. And like I said, the best thing is that you get the one-on-one attention. And they work with you. They don't rush you. Whatever your pace is, they work with that. They listen to you. They answer your questions. Whatever your needs are, they tend to them.